the top 1% of Americans, the rich, live 10 years longer than the poorest 1%. And we want to kind of level the playing field in making sure that those individuals who are living in poverty or haven't graduated high school get to. So our team focuses on quality of life and improving quality of life for our West Kendall community residents, those who work, play, and live in West Kendall. Healthy West Kendall, while our backbone is Baptist Health and West Kendall Baptist, we do have an advisory board which is made up of more than 20 different organizations. We collaborate and join forces with community partners, with businesses, with schools. We will do events at churches, at small businesses. We do screening events. We do education on hand hygiene and swim safety with community partners. We try our best to educate middle and high school students on tobacco and vaping and the risk of heart disease. Healthy West Kendall is a healthcare hero as we try our best to serve all the needs of our community as much as possible in collaboration with our partners.
Jewish Community Services of South Florida is a healthcare hero because they go above and beyond caring for the whole human being through the entire expanse of their lifetime. JCS addresses the physical, emotional, and social needs of the community in a very holistic approach. So they address trauma issues, healthy aging issues, housing issues, as well as pro-social issues from early education and early ages, even into far adulthood. JCS supports survivors of the Holocaust, and in a time when history is really being challenged, we see JCS step to the fore and make sure that dignity, kindness, and the human story is never forgotten. So they work with organizations, they work with volunteers, they work with their staff and teams. I think the compassion in what they do kind of comes through everything, because sometimes you need someone for a season. And I hope that those who come in contact with JCS feels that level of compassion and that level of readiness to kind of take on the future.
The behavioral health crisis that we've seen, and it was accentuated during COVID when children were isolated in their homes. We saw this through increased visits in our emergency departments, where we were having double the amount of patients that were coming in with behavioral health issues. So that put a stress on the system. The behavioral health program at Nicholas Children's has done phenomenal work across South Florida. Initially, we had a 20-bed psychiatry unit at the main hospital. And we've expanded that now and doubling it now to 40 beds. We do have the Behavioral Healthcare Network that partners with other institutions in terms of being able to provide the mental health services. We also have the implementation of the psychologists within the pediatric offices that also assist our pediatricians in the community. And then we do efforts such as the Zero Suicide Initiative. The behavioral health program at Nicholas Children's, they're heroes in my eyes just because of the great need that's in the community and across the country. And they have done a fantastic job in terms of addressing that need.